The U.S. has confirmed its first case of the Wuhan virus, and authorities are expecting more cases to emerge.
The patient is a man in his 30s. He was hospitalized on Sunday after arriving in Seattle from Wuhan in central China, where the virus originated. The health authorities say that he's in good condition and is being isolated for short-term monitoring out of an abundance of caution. The U.S. Centers for Disease Control and Prevention considers the risk of his case as low to the general public, and despite increasing concern about the possibility of human-to-human infection.
Well, he entered the U.S. just 2 days before the health screenings for travelers from Wuhan began at airports in Los Angeles, New York, and San Francisco. Now, he's said to have approached health authorities himself after reading news reports about the virus.
The Danielle Robertson in Los Angeles tells us how the CDC plans to tackle the potential spread of the virus in the U.S.
The CDC has raised the alert level from 1 to 2. There are 3 levels, so it hasn't gone to the maximum level just yet. They are looking into possible vaccines. Of course, there was a new case this week of human-to-human contraction of this coronavirus, and that does raise concern, particularly here for Los Angeles and the United States. This is a time in the United States of the Lunar New Year, meaning that hundreds of millions of people are travelling from the region of China to the United States to celebrate the Lunar New Year, and with those results of the human-to-human contact, it does make it a little bit more difficult to contain. So they're very concerned about that. The World Health Organization is also holding an emergency meeting tomorrow to try and decide whether or not they have to raise this level even further. But authorities across the United States and the globe are really ramping up this screening and quarantine process to stop this from spreading any further.